NAMAF's head for corporate services, Brian Chaka, explained that any profits medical aids make are ploughed back into those institutions to ensure they remain operational. Chaka added that there are competing interests in the medical aid industry amongst the members who contribute monthly, the providers of healthcare services, and the medical aid funds.
Now, the idea of medical aid funds, as they were and as it is now, they don't make profit. The surpluses and investments they make, they should be set aside to create space for when there's drought. Now, the motive of profit in medical aid funds does not work. And hence, when I started, I said this is a social security legislation in its context, and that is the purpose as to why government would have created the funds. A provider would render a service and they would expect to be paid. They would expect to be paid for everything that they would have done for and to a member. But then this money is where? These monies are in the pots that the 7 funds are having. Now, the funds are having benefits and levels with limits of what they can pay, because resources are not in abundance, and that's a sustainability component. Now, when you look at this triangle alone, if that is a triangle, a member would not want to pay money out of pocket on the point of sales, because I'm paying every month. A provider would tell you, but I'm rendering a service, I must be paid for my services. A fund will tell you, but wait a minute, I do not have all the resources to pay.
NAMAF's CEO highlighted the complexity of the medical aid fund industry, noting that tension between the funders and providers of healthcare services call for more collaboration between the two to create a system that will make settling claims easier.
As it were, you would appreciate that a funder is not necessarily an expert in healthcare delivery. And as you can tell, the number of disciplines available to us. We are sitting with in excess of 3,000 healthcare providers with NAMAF practice numbers. Ramona would have spoken to you about how many disciplines there is. And funders, where they are sitting, has to provide for each and every of those disciplines. The risk that is inherent in the way how you carry out your service might not also be known to a funder. Therefore, in the billing rules and guidelines, an attempt is made to structure codes that could be billed together and those that cannot be billed together.
NAMAF Stakeholder Relations and Communications Manager Watavi Mbai added that the engagement with stakeholders, coupled with the launch of its social media pages, demonstrates NAMAF's commitment to information sharing aimed at getting feedback to improve its systems.